I'm going to present a topic and something I don't know yet because I made it in just like before coming. Yeah, so I know the topic, but yeah, this is going to So we're going to know about the liver today. Its palpation, its anatomy, its location, homeopathic treatment, and also some abnormalities. Okay. So this is our liver. So it's a spooky liver. So first, before knowing that, we should know about the quadrants and all the organs situated in every different quadrants. So we'll see once. So we have right hypochondriac, epigastric region, left hypochondriac, right lumbar, umbilical region, left lumbar, right iliac. So I'm still trying to study. So now we come to the main topic, which is palpation of the liver. So the liver predominantly lies on the right side, of, although it does cross the midline. Can anyone tell in like which which all ribs starts the liver, like starting and ending?
7 to 11.
7 to 11.
Nice. Guys are good. That's it. So So, as the enlarged liver continues to move downwards, lift the finger. The enlarged liver will lift the finger a bit. So, we will examine the patient. First, we will explain the quadrants. This is the right hypochondriac, this is the epigastric, and this is the left hypochondriac. This is the right lumbar, this is the umbilical region, this is the left lumbar. This is right iliac, this is hypogastric, and this is left iliac. Palpate the liver right now because this is the topic we are dealing with today. So first we'll go to the costal margin in the right iliac area. The left thumb is extended to expose the lateral margin of the index finger. The hand is positioned so that the lateral margin of the index finger is parallel to the costal margin. Now the patient is asked to take a deep breath. So please take a deep breath. And the pressure is applied to the abdominal one and examination hand. If the liver is not palpated, the examining hand is moved closer to the costal margin, about 1 centimeter. The patient is asked to repeat the deep inspiration. So can you repeat the inspiration? And the process is repeated until you find or palpate the liver. Treatments for liver health. So we have Nux vomica, Cardus marimus, Lycopodium, and Cynothus virginiax. So it is effective for liver dysfunction associated with overeating and alcohol consumption. So I guess you guys will know about the thing. So Nux vomica you can take if any one of you have such problems. Liver dysfunction due to alcohol. So Cardus marimus knows to support liver health and enhance the blood flow. Often recommended for fatty liver condition. So this is basically homeopath's choice. This one, Cardus marianus. This is very commonly given. Lycopodium, it is used for symptoms such as bloating, indigestion, linked with liver disorders. So I end my slide with this.
No, plus.
So yeah, thank you.
Good morning, my name is Muzammil Ahmad. I am going to explain about the examination of the gallbladder. Before that, let's gush up with the anatomy of the gallbladder. So it is located in the right hypochondriac, that is nearly ninth right side of the rib. Okay, it is a small sac attached to the visceral surface of the liver. The length is going to be 10 centimeter and the breadth 3 centimeter. So the parts of the gallbladder is fundus, body, and neck. So like the neck has cystic duct which is attached to the common hepatic duct. So the physiology of the gallbladder is to store, to concentrate, and to release the bile products. which helps in digestion of the food. So the most common Now I'm going to perform Murphy's sign on the patient. So first we should place our fingers or hand under the ninth rib to examine the gallbladder or cholelithiasis. So first I should place the hand on the patient, then say the patient to take a deep inspiration. If the sign is positive, there is going to be halt in the inspiration with the sharp pain as my fingers touch the gallbladder. So there is no halt, so the sign is negative, but there can be a small stones in the gallbladder. So examine whether the stones are there or not. So we should go for abdominal USG or CT scan, that is which helps us to know the complications like diseases, blockages and acute cholecystitis. MRCP, that is magnetic resistance, color pancreatitis, pancreatography, that is stones in the bile duct, then endoscopic ultrasound, that is for small stones, and we can even go for IDA scan, that is cholecystography, that is for the function of the gallbladder and bile duct, endoscopic retrograde cholangiopancreatography, that is ERCP, for both diagnosis and the treatment of the bile stones.
Any questions from anybody?
Good morning everyone. So today I'll be telling about clinical examination of spleen. So spleen is a organ in abdomen which is located in the left hypochondrium. So we'll first study about the anatomy and physiology of it. So anatomy, its location is in the upper left quadrant of the abdomen. It is highly profused with vascularity. It has splenic artery which supplies the blood. Then the outer layer is enclosed by a weak connective tissue. It has two main structures in the spleen, that is red pulp and white pulp. So white pulp contains lymphocytes, the T lymphocytes and B lymphocytes, and red pulp contains sinusoids, splenic cords where blood is getting filtered. As we saw in the video, the spleen is not normally palpable in normal patients, but when it is enlarged, the characteristics are like it extends till iliac fossa. There is the enlarged spleen moves freely during inspiration, and the characteristic sign of splenic swelling is sharp anterior border, and one or two notches are being felt during this examination. in splenic conditions. Then China officinalis is also given. It's the second best remedy after Sionanthus americanus. Then iodine is also indicated during splenic enlargement. Quercus is also is for splenic enlargement with ascites.
So now I'm going to conclude the palpation method of liver. Now I'm going to start with the palpation of liver. We have to place our hand in the right iliac region and palpate it. Now we'll ask the patient to take a deep breath. So please take a deep breath. As it is normal, we are not able to see any changes. As the liver is healthy, we cannot able to see any movement in thumb. If we have enlargement in the liver, we'll have movement in the thumb region also.
Murphy sign is positive in cases of cholecystitis and cholelithiasis. Now I'll be concluding for the palpation of the gallbladder. I'll be also elucidating the positive or negative Murphy sign. Checking for the Murphy sign, will be elucidating it over the right side of the subcostal area, where we'll be touching and asking the patient to inspire. On inspiration, if patient feels any kind of pain or tenderness by the examiner's finger, then the patient will be having positive Murphy sign. And we have to also check for the patient's expression, because it is tenderness, so patient might express it by facial expressions.
I'm going to give the conclusion about the summary here. So now I'm going to explain the 9 quadrants of the abdomen.
This is right hypochondric and left hypochondric and epigastric, and right lumbar, left lumbar and umbilicals, and right iliac, left iliac and hypogastric region.
Today I'm going to do the clinical examination of the spleen. In the clinical examination of spleen, we have 4 points: the inspection, palpation, percussion and the auscultation. In inspection, there will be no much signs which can be seen in case of splenomegaly. In palpation, we have 4 methods, that is the classical method, bimanual method, hooking method and the dipping method. Now I am going to do the classical method. In the classical method, the patient should be lying on the supine position and the knee should be in the semi-flexed position, and we have to palpate from right iliac fossa to the umbilical region. Now I am going to palpate from the right iliac fossa to the left hypochondriac region. If there is any enlargement, the splenomegaly enlargement is in the direction towards the umbilical region. As the patient is not having any splenomegaly, we cannot palpate any enlargement of spleen. In the Castle sign, we have to do the percussion. During percussion, at the peak inspiratory stage, it is nothing but the dull sound can be percussed, and during the expiration, it is nothing but the tympanic sound in case of splenomegaly.